Have you ever wondered why some of the simplest, most powerful health remedies are almost never talked about? Why is it that a basic ingredient sitting quietly in your kitchen, something as ordinary as baking soda, rarely makes headlines for its health-transforming potential? Here's the unsettling truth. There's no big money in simple, natural solutions. And when a remedy like baking soda water can support everything from digestion to inflammation, even helping with joint pain and sleep, you have to ask, why isn't this common knowledge? Now consider this. More than 350 million people worldwide suffer from inflammatory conditions like arthritis, digestive issues, and acid reflux. Millions more are battling poor sleep, chronic fatigue, or kidney-related problems. Could something as inexpensive as baking soda water offer real relief? In this video, we're diving deep into the science-backed health benefits of drinking baking soda water at night. And trust me, some of these might completely surprise you. But here's the kicker. At the end of this video, we'll reveal exactly how to prepare baking soda water the right way, how much to take safely without risking your health, and how long to use it to start noticing real benefits. So don't just skip around. Watch till the very end, because the way you use it makes all the difference. Drop a comment below and let us know where in the world you're tuning in from. We love seeing how far our natural health community reaches. And if you're new here, welcome to the journey. Hit that like button and subscribe, because your path to better health starts right now. Let's get into it. Just a quick reminder, the information in this video is for educational purposes only and not a substitute for professional medical advice. Every detail shared here is verified by professional researchers, with all references provided in the description. All right, let's jump right into the powerful health benefits of drinking baking soda water at night. Starting with number 1. Relieves nighttime heartburn and acid reflux. Lying in bed, the familiar burn creeps up the chest, a nightly ritual for many grappling with acid reflux. This discomfort arises when stomach acid escapes into the esophagus, often due to a weakened lower esophageal sphincter. While lifestyle adjustments like elevating the bed's head or avoiding late meals can help, some seek immediate relief. Sodium bicarbonate, commonly known as baking soda, offers a quick fix. Its alkaline nature neutralizes excess stomach acid, providing temporary respite from heartburn. Interestingly, a 2022 study published in BMJ Open Gastroenterology explored the effects of bicarbonate-rich mineral water on heartburn. The randomized controlled trial found that participants consuming this mineral water experienced significant relief from heartburn symptoms compared to those given a placebo. This suggests that natural sources of bicarbonate can be effective in managing acid reflux. While these remedies can offer temporary relief, it's crucial to consult with a healthcare professional for persistent symptoms. Chronic acid reflux may indicate underlying conditions like gastroesophageal reflux disease, requiring comprehensive treatment. Always approach such remedies with caution and under medical guidance. Next, number 2. Reduces muscle soreness. It's late. The gym session from earlier still lingers. Tight quads, sore hamstrings, a dull ache in the shoulders. For anyone who's pushed their limits, that familiar soreness can be a mixed badge of honor and discomfort. But what if the nighttime routine included something as unexpected as a pinch of a common kitchen staple? Something that's been quietly studied in sports science labs? Sodium bicarbonate, widely known for its role in baking, plays an entirely different role in muscle physiology. After high-intensity exercise, our muscles are flooded with hydrogen ions that drop the pH, making the environment acidic. This shift contributes significantly to muscle fatigue and soreness. Sodium bicarbonate acts as a buffering agent, helping to neutralize this acidity, and research now points to its power in speeding up recovery. According to a 2019 study in the Frontiers in Nutrition, sodium bicarbonate supplementation improved recovery by restoring the body's acid-base balance after intense workouts. The researchers highlighted that taking it during the recovery window raised blood bicarbonate concentration and pH, creating a more favorable environment for muscular recovery between exercise bouts. This wasn't just about reducing soreness, it potentially prepped the body for better performance in subsequent sessions. So while a warm shower and stretching can help, there's fascinating science emerging behind how the body bounces back. And sometimes it starts with something as humble as a spoonful of bicarbonate before bed. Next, number 3, supports kidney function. Nighttime offers a unique opportunity for the body to engage in restorative processes, and for individuals managing chronic kidney disease or CKD, this period can be particularly beneficial when supported by appropriate interventions. One such intervention is the correction of metabolic acidosis, a common complication in CKD, through the administration of sodium bicarbonate. Metabolic acidosis arises when the kidneys are unable to excrete enough acid or conserve enough base, leading to an imbalance that can accelerate the progression of CKD. By addressing this imbalance, sodium bicarbonate helps to stabilize the body's internal environment, potentially slowing kidney function decline. A comprehensive meta-analysis published in 2021 in Frontiers in Pharmacology examined the effects of oral sodium bicarbonate on patients with CKD. The study found that sodium bicarbonate supplementation significantly increased serum bicarbonate levels and slowed the decline in estimated glomerular filtration rate, a key indicator of kidney function. Additionally, it noted improvements in vascular endothelial function, which is crucial for cardiovascular health, a common concern in CKD patients. Incorporating these interventions during the nighttime, when the body is naturally inclined towards repair and regeneration, may enhance their efficacy. However, it's essential to approach such treatments under medical supervision to tailor the approach to individual needs and avoid potential complications. Next, number 4. Help with gout symptoms. Imagine lying in bed, your big toe throbbing with pain so intense it feels like it's on fire. That's the cruel reality of a gout flare, often striking at night, stealing sleep and peace. Gout, a form of arthritis, results from uric acid crystals accumulating in joints, leading to sudden and severe pain. Now consider a simple compound found in many kitchens, sodium bicarbonate. When combined with benzbromarone, a medication that increases uric acid excretion, it has shown promise in managing gout symptoms. A 2024 study published in the British Journal of Hospital Medicine evaluated this combination therapy. Patients receiving both treatments experienced significant reductions in serum uric acid levels, fewer tophi, uric acid crystal deposits, and improved kidney function compared to those receiving sodium bicarbonate alone. Importantly, the combination was well tolerated, with no significant increase in adverse effects. The mechanism is straightforward. Sodium bicarbonate alkalizes the urine, increasing the solubility of uric acid and promoting its excretion. This process helps prevent the formation of new uric acid crystals and may aid in dissolving existing ones. Benzbromarone complements this by enhancing the kidney's ability to eliminate uric acid. However, it's crucial to approach this treatment under medical supervision. Excessive intake of sodium bicarbonate can lead to metabolic alkalosis, a serious condition characterized by elevated blood pH levels. Therefore, while the combination therapy holds potential, it must be administered carefully. Next, number 5, balances pH in the body. After a long day, the body's internal chemistry reflects the cumulative effects of stress, diet, and activity. This can lead to a slight acidification of the body's internal environment. Maintaining a balanced pH is crucial for optimal cellular function, and the body employs various mechanisms to regulate this balance. One such mechanism involves the use of bicarbonate ions, which act as buffers to neutralize excess acids. A recent study published in the Journal of Nutritional Biochemistry in 2024 explored the impact of consuming bicarbonate-rich mineral water on acid-base balance. Participants who consumed 1.5 to 2 liters of this mineral water daily exhibited a significant increase in urinary pH and a reduction in net acid excretion, indicating a shift towards a more alkaline internal environment. This research highlights the role of bicarbonate, a compound naturally present in certain mineral waters, in supporting the body's pH regulation. By providing an external source of bicarbonate, such water can assist the body's buffering systems, especially during periods of increased acid load. It's important to note that while the body has robust systems to maintain pH balance, dietary choices can influence these processes. Incorporating bicarbonate-rich mineral water may offer additional support, particularly for individuals with diets high in acid-forming foods. However, it's essential to approach this as a complementary strategy rather than a primary solution. Next, number 6, Managing urinary tract infection. As the evening unfolds and the day's hustle winds down, the discomfort of a urinary tract infection, or UTI, can become more pronounced, disrupting rest and peace. In such moments, some individuals consider natural remedies to alleviate symptoms. One such remedy is sodium bicarbonate. The rationale behind this approach lies in the nature of UTIs. These infections often thrive in acidic environments, and the burning sensation during urination is partly due to this acidity. By introducing an alkaline substance like sodium bicarbonate, the urinary pH can be elevated, potentially creating a less hospitable environment for bacteria and reducing discomfort. A study published in the International Urogynecology Journal explored this concept. Researchers administered oral sodium bicarbonate to female patients with lower urinary tract symptoms, or LUTS, and acidic urine pH. Over 4 weeks, participants experienced a significant increase in urine pH from an average of 5.31 to 7.2. This alkalization correlated with notable reductions in urinary frequency, urgency, and nocturia. The study concluded that oral sodium bicarbonate could be an effective, low-risk option for managing LUTs associated with acidic urine. However, it's essential to approach this remedy with caution. Excessive intake of sodium bicarbonate can lead to serious health issues, including electrolyte imbalances and alkalosis. Therefore, anyone considering this treatment should consult with a healthcare professional to ensure it's appropriate for their specific situation. Next, number 7, prevents cancer. In the quiet hours of the night, when the world slows down, some individuals explore unconventional methods to support their health. One such method involves the use of sodium bicarbonate, commonly known as baking soda. While it's widely recognized for its household uses, recent scientific investigations have delved into its potential role in cancer therapy. A 2024 study published in Frontiers in Oncology examined the effects of sodium bicarbonate on tumor acidity. The research highlighted that administering sodium bicarbonate could neutralize the acidic environment surrounding tumors, potentially inhibiting cancer progression. In particular, the study observed that mice with malignant ascites, a condition characterized by fluid accumulation due to cancer, showed extended survival rates when treated with sodium bicarbonate solutions compared to control groups. Additionally, a case study within the research detailed a patient with chemotherapy-resistant ovarian cancer who experienced a significant reduction in tumor markers and acidic fluid after receiving sodium bicarbonate treatment. These findings suggest that sodium bicarbonate may influence the tumor microenvironment, making it less conducive to cancer cell survival and proliferation. However, it's crucial to note that these studies are preliminary, and more extensive clinical trials are necessary to fully understand the implications and safety of such treatments. As always, individuals should consult with healthcare professionals before considering alternative therapies. Next, number 8, relieve symptoms of rheumatoid arthritis. After a long day battling the relentless ache in her joints, Maria found solace in a simple nightly ritual. She would mix a small amount of baking soda into a glass of water and drink it before bed. This routine surprisingly brought her a sense of relief from the persistent inflammation caused by rheumatoid arthritis. The science behind Maria's experience lies in the body's immune response. Rheumatoid arthritis is characterized by an overactive immune system that mistakenly attacks healthy joint tissues, leading to inflammation and pain. A study published in the Journal of Immunology explored how oral intake of sodium bicarbonate could influence this immune activity. Researchers found that consuming baking soda led to a shift in the spleen's macrophage population from pro-inflammatory M1 cells to anti-inflammatory M2 cells. This change suggests that baking soda can promote an anti-inflammatory environment in the body. For Maria, this meant fewer flare-ups and more restful nights. While baking soda is not a cure for rheumatoid arthritis, its potential to modulate the immune response offers a glimmer of hope for those seeking alternative ways to manage their symptoms. As always, it's essential to consult with a healthcare professional before starting any new treatment regimen. Next, how to take baking soda at night for health benefits. Safe dosage, timing, and duration. Simplicity meets science when it comes to using baking soda as a natural health tool. But timing, dosage, and safety matter more than anything. To start, the ideal time to consume baking soda is about 1 to 2 hours after your last meal, right before bed. This allows your stomach to settle and reduces the risk of acid buildup overnight, which is often the trigger for discomfort, especially in cases like arthritis-related inflammation or acid reflux. As for the dosage, 1/2 teaspoon or about 2.5 grams, dissolved in a glass of cold or room temperature water, 6 to 8 ounce, is considered safe for occasional use by most healthy adults. Stir until it's fully dissolved and sip it slowly, not chugging, so your stomach can absorb it without becoming overly distended. Now let's talk duration. If you're trying this for potential anti-inflammatory effects, like in rheumatoid arthritis support, you'll need to give it at least 2 weeks of consistent, alternate day use to potentially notice subtle changes. That said, long-term daily use is not recommended without medical supervision due to risks like high sodium intake, alkalosis, or digestive imbalance. For general wellness, 1 to 2 times a week may be sufficient and much safer over the long haul. Used mindfully, this humble kitchen staple can become a quiet ally in your nightly wellness routine, just like it did for Maria. Small dose, big impact. Next, who should avoid taking baking soda at night? Know the risk before you sip. Before reaching for that glass of baking soda and water, it's essential to know that this remedy, though natural, isn't safe for everyone. People with high blood pressure should be especially cautious. Baking soda is high in sodium, and even small amounts can raise blood pressure or worsen heart conditions when used regularly. If you're on a sodium-restricted diet or take medications like diuretics, corticosteroids, or antacids, baking soda can interfere or amplify the effects. This can disrupt your electrolyte balance, leading to muscle cramps, weakness, or worse, alkalosis, a condition where your blood becomes too alkaline. Pregnant women should not use baking soda as an antacid or remedy without a doctor's approval. It can cause fluid retention and impact blood pressure levels during pregnancy. People prone to stomach bloating, gas, or gastrointestinal discomfort might find that baking soda causes more harm than help if used too often. When it reacts with stomach acid, it releases carbon dioxide gas, leading to a bloated, gassy feeling. And if you have a history of heart disease, especially congestive heart failure, steer clear. The added sodium can increase the workload on your heart. Bottom line, baking soda isn't a universal remedy. What helps one person sleep better or feel less inflamed could harm someone else. Always check with your healthcare provider before starting, especially if you fall into any of these categories. And that's it for today's video. Now it's your turn. Are you using baking soda water at night? If yes, we'd love to hear from you. Have you noticed any difference in your health? Maybe better digestion, reduced inflammation, or improved sleep? Whatever your experience, drop it in the comments and let's start a conversation. Your stories might just help someone else on their wellness journey. And hey, if this video was helpful, please type yes in the comment box. That one word might seem small, but it seriously motivates us to keep creating more science-backed health content just like this. Don't forget to like, share, and subscribe if you haven't already. Your support means everything, naturally. Thanks for watching, and as always, take care of your health.